My name is Hattie Stretz, and I was a stroke patient at Los Alamitos Medical Center. My husband and I and our daughter, our son-in-law, and our 3 grandsons were having breakfast at a local restaurant, and we walked out to the car, and when we got to the car, my husband and daughter looked at me and said, "You're having a stroke." And I was totally perplexed because I didn't feel like anything was wrong with me. They said, "You're talking kind of gibberish, and the left side of your mouth is kind of drooping, and you look like you're sagging to one side." Well, I didn't feel any of this, and they said, "We're calling 911." And I said, "Don't call 911, there's nothing the matter with me." But they did call, and by the time the ambulance got here and took me to the local hospital, I was paralyzed on my left side. So they brought me into the emergency room at Los Alamitos Medical Center, and of course they did tell me that I was having a stroke. So they told me that they were going to take me to the biplane cath lab to do an intervention. And being a retired RN, I knew that they were probably going to do some kind of angiogram, but I'd actually never heard of them going into somebody's brain and taking a clot out so that they didn't have the stroke symptoms. But that is indeed what they did to me. So then after they brought me out of the intervention, the doctor came out and showed my husband and I on his telephone what my brain looked like with the clot in it. And it looked like a part of it, about the size of a plum, looked like a white cotton ball. There was absolutely no red lines in there at all. And then he showed us another picture after the clot had been removed. It was just filled with little red capillaries all through that area. A couple of things I would like to say about the staff at the Los Alamitos Medical Center is from the emergency room, ICU, out on the medical surgical floor. I was on both of those. Every staff member treated me with respect and dignity, and they knew their job and how to perform it very well.